Hey everyone, so I would like to talk to you today about the journey of healing from trauma. Healing from trauma can be a long and challenging journey, but knowing what to expect can make all the difference. In this video, I'm going to explore the process of recovering from trauma, including the emotional highs and lows, and the physical symptoms, and the steps that you can take to start healing. From acknowledging your trauma and seeking support to developing coping strategies and rebuilding your sense of self. I'm going to cover it all. Well, maybe not everything, but I'm going to cover a bunch of stuff. If you're ready to take the first steps towards healing and reclaiming your life, then keep watching. Get ready to start your journey towards healing and recovery. My name is Dr. Jamie Kirkpatrick, and I've been working with trauma survivors since 1989. Yes, I'm that old. And the satisfaction that I get when I see transformation from surviving to thriving is astronomical. I just love my job and I love dealing with this population. My own journey through healing from trauma has been pretty long and arduous. Um, but just as I have done, you can also expect joy, through healing along the way. In the United States, nearly half of all adults have experienced at least one trauma in their lifetime, although the National Council for Mental Well-being estimates the number at 70%. Remember, though, that not all people who have been traumatized develop PTSD. However, post-traumatic stress has definitely increased among military and veterans, particularly among those who have served in recent conflicts like Iraq and Afghanistan. While PTSD is not exclusive to the military, it is more prevalent among veterans than it is in the general population, and some studies indicate a 2 to 4-fold increase. That's astonishing. In fact, U.S. veterans experience an average of 20 suicides per day. That's 20 too many. Even though it may be difficult to heal from trauma, it is abundantly important because unresolved trauma can quietly shape how you think, feel, and act, often leading to anxiety, depression, strained relationships, problems with your physical health, and a reduced sense of safety and self-worth. When you work through and heal from those experiences, you free yourself from the constant grip of past pain, reclaim control over your thoughts and emotions, and open space for healthier relationships, better decision making, and greater resilience. In essence, healing allows you to live in the present with more peace, self compassion, and hope for the future, rather than being tethered to what hurt you. But there are problems that people face in healing from trauma. They often face challenges such as intense emotional pain, fear of revisiting painful memories, and difficulty trusting themselves or others. They might experience setbacks like flashbacks, anxiety, or self doubt, and sometimes feel isolated because other people can't fully understand their experiences. Shame, guilt, or stigma around seeking help can also make it a lot harder to open up, while unhealthy coping mechanisms like avoidance, substance use, or overworking can temporarily numb the pain, but it slows recovery. These hurdles can make the healing process feel overwhelming, yet each small step forward builds strength and resilience. But healing from trauma and PTSD, or PTS, is not a one size fits all process. Different approaches work for different people depending on their unique experiences, needs, and resources. Recovery often involves a combination of therapeutic, self care, and social support strategies that address the mind, body, and emotions. So, let's look at evidence based therapies. There's trauma focused cognitive behavioral therapy, which helps people identify and change negative thought patterns related to their trauma. And then you have eye movement desensitization and reprocessing, or EMDR. This is a therapy that uses bilateral stimulation, like eye movements or tapping or auditory stimulation, sound, while recalling trauma and focusing on the thoughts and feelings associated with that trauma. And this helps the brain reprocess distressing memories and can actually be really effective for some people in reprocessing trauma. Then you have prolonged exposure therapy. This gradually reduces avoidance by safely confronting trauma related memories, thoughts, and triggers. But as I've said before in other videos, this is something that shouldn't be done without the involvement of a therapist, in my opinion. And then you have somatic experiencing, which focuses on bodily sensations to release stored trauma and restore a sense of safety in the body. Next, we have medication support. While I'm not a big proponent of medication, at least not in general, and it should only be used short term, in my opinion. Antidepressants like SSRIs or SNRIs can reduce anxiety, depression, and hyperarousal symptoms. Sleep aids or anti-anxiety medications may be prescribed for short-term stabilization. Next, you might want to try body-based approaches such as like yoga, Tai Chi, and Qigong, which can help regulate the nervous system and reconnect the mind to the body. These interventions can be hugely helpful in the treatment of trauma and helping to regulate heart rate variability. There's also breath work and mindfulness meditation, which support calming the stress response and improving emotional regulation. Then you have massage therapy, acupuncture, craniosacral therapy, which may help release, physical tension linked to trauma. And then we have creative and expressive methods. These are more right-brained experiential therapies, which can really help to reprocess trauma, such as art therapy, music therapy, or dance and movement therapy. They provide a nonverbal way to express and process trauma. Journaling can also help organize your thoughts and recognize triggers and track your process and healing. I know a lot of people don't like to journal, but it can actually be really helpful to get those thoughts out of your brain and down on paper. Then we have social and relational healing. So this includes like support groups, right? Whether peer-led or therapist-led, which can reduce isolation and provide understanding from others with similar experiences. And then there's having trusting relationships, right? With friends, family, or mentors that can help restore a sense of safety, connection, and belonging. And don't forget community involvement or volunteering, which both help rebuild purpose and self-efficacy. Next, let's look at lifestyle and self-care practices. Regular exercise, for instance, improves mood, reduces hyperarousal, and supports better sleep. Healthy nutrition and sleep hygiene stabilize energy and emotional resilience. Grounding techniques, like focusing on the five senses, using cold water, carrying a grounding object, any of those things can help manage flashbacks and dissociation. In fact, that makes me think of cold plunge or even taking a cold shower at the end of your shower. They can be really effective for trauma by helping you to slow your breathe and then learn how to control your breathing and build resilience. It also decreases inflammation and builds your immune system. Next, let's look at spiritual and meaning making practices. For some, faith practices, meditation, or prayer can offer strength, comfort, and a framework for making sense of suffering. Practices of gratitude and compassion can foster resilience and positive emotional states. Now, let's look at the concept of healing strategies over time and the benefits. Long term, healing requires patience and self compassion because recovery is often nonlinear. And as a matter of fact, it's usually nonlinear and it will take you in a lot of different directions with various, frequencies, durations of intervention. And through learning different healing techniques, you can build a personalized toolbox of coping strategies, which ensure that you can manage triggers in daily life. And most people benefit from an integrative approach, combining professional treatment, lifestyle adjustments, and supportive community resources. Ultimately, trauma recovery is about regaining a sense of safety, control, and connection. Some people heal best through structured therapy, while others find empowerment and creative expression, body based practices, or supportive relationships. In other words, while there are many symptoms and manifestations of trauma that are similar between people, healing from trauma is a journey that varies for everyone. So I encourage you to tell us about your experiences in the comments. And if you want to learn more about trauma, such as what trauma response is, I suggest that you check out this video right here. So I thank you all for being here and watching, and I hope that you have a wonderful and awesome day.